CMA Medical Assistant Practice Test. Question 1. During a follow-up visit, a new patient begins explaining the main reason for the visit. Which item should be captured as the chief concern? Option A. The patient's primary reason for seeking care today. Option B. The brand of exam table used. Option C. The clinic's appointment schedule. Option D. The insurance plan name. The correct answer is option A. The patient's primary reason for seeking care today. The chief concern identifies why the patient came for care and guides the visit workflow. Insurance details, equipment information, and the clinic schedule do not describe the patient's presenting problem. Question 2. When preparing safe patient care, a blood specimen label is about to be placed on a tube during a realistic certification question. Which action best prevents patient identification errors? Option A. Label the tube after returning to the desk. Option B. Verify two identifiers such as full name and date of birth before labeling. Option C. Ask another patient to confirm the name. Option D. Use the room number as the only identifier. The correct answer is option B. Verify two identifiers such as full name and date of birth before labeling. Two identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 3. A medical assistant reviews a case where a tympanic temperature is ordered for an adult patient. Which technique is appropriate? Option A. Use the same technique for every age without adjustment. Option B. Force the probe deeply into the ear canal. Option C. Position the ear canal according to device instructions before inserting the covered probe. Option D. Use the probe without a cover to improve contact. The correct answer is option C. Position the ear canal according to device instructions before inserting the covered probe. Tympanic accuracy depends on proper ear canal positioning and a clean probe cover. Uncovered probes, forceful insertion, and ignoring age-specific technique can cause infection risk, discomfort, or inaccurate readings. Question 4. For a patient scheduled for a procedure in an outpatient setting, an adult patient has a respiratory rate of 18 breaths per minute at rest. How should this rate generally be interpreted? Option A. It is within the usual adult resting range. Option B. It is always a medical emergency. Option C. It indicates apnea. Option D. It proves the patient has asthma. The correct answer is option A. It is within the usual adult resting range. A resting adult respiratory rate of 18 per minute generally falls within the expected range. It does not indicate absence of breathing, does not automatically represent an emergency, and cannot diagnose asthma by itself. Question 5. For an older adult in an outpatient setting, a medical assistant needs more detail about a patient's abdominal discomfort after the patient asks a follow-up question. Which question uses an open-ended interviewing technique? Option A. Is the pain exactly a 5? Option B. Can you describe what the discomfort feels like? Option C. Does it hurt, yes or no? Option D. You do not have nausea, correct? The correct answer is option B. Can you describe what the discomfort feels like? Open-ended questions invite the patient to describe symptoms in their own words and often reveal more complete information. Yes or no prompts, forced ratings, and leading questions limit the response and may miss important details. Question 6. After confirming the patient's identity, gloves are removed after contact with a patient's wound dressing for a patient who appears anxious. Which action should follow? Option A. Wash hands only at the end of the shift. Option B. Reuse the gloves for the next patient. Option C. Touch the keyboard before cleaning hands. Option D. Perform hand hygiene immediately after glove removal. The correct answer is option D. Perform hand hygiene immediately after glove removal. Gloves can have tiny defects or contaminate hands during removal, so hand hygiene is required after removal. Reusing gloves, touching shared surfaces first, or delaying hand hygiene increases cross-contamination risk. Question 7. When preparing safe patient care, a used needle has just been removed from a syringe after an injection. Which action is safest? Option A. Place the sharp immediately into an approved sharps container. Option B. Carry it uncovered to the front desk. Option C. Recap it using 2 hands before disposal. Option D. Drop it in a regular trash can. The correct answer is option A. Place the sharp immediately into an approved sharps container. Used sharps should go directly into a puncture-resistant sharps container to prevent injury and exposure. Carrying, recapping with 2 hands, or using regular trash creates avoidable needle stick risk. Question 8. For a patient asking for clarification in an outpatient setting, a patient is placed on contact precautions for a draining wound while following standard precautions. Which PPE is typically expected when entering for direct care? Option A. No PPE because drainage is covered. Option B. Sterile gloves instead of all other PPE. Option C. Only a surgical mask for every interaction. Option D. Gloves and gown as indicated by the isolation signage. The correct answer is option D. Gloves and gown as indicated by the isolation signage. Contact precautions commonly require gloves and gown for direct contact with the patient or environment. A mask alone, no PPE, or sterile gloves without other indicated protection does not match the purpose of contact precautions. Question 9. After confirming the patient's identity, a patient has symptoms consistent with influenza for a returning patient. Which PPE is commonly used for close contact? Option A. A surgical mask with standard precautions. Option B. No mask because influenza is not contagious. Option C. A lead apron. Option D. Only sterile shoe covers. The correct answer is option A. A surgical mask with standard precautions. Droplet precautions help reduce exposure to respiratory droplets during close contact. Lead aprons, no mask, and sterile shoe covers do not address the main transmission route for influenza-like illness. Question 10. While following clinic policy, the medical assistant notes that a patient has a small foreign material exposure in the eye. Which action is appropriate before irrigation? Option A. Apply random medication drops without order. Option B. Ignore contact lenses and begin forcefully. Option C. Check the order or protocol and use appropriate solution and protection. Option D. Use a dry cotton swab across the cornea. The correct answer is option C. Check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 11. During a skills check, the scenario states that a container holds blood-contaminated disposable materials while maintaining privacy. Which label or container is appropriate? Option A. A biohazard marked container according to facility policy. Option B. An unlabeled cardboard box. Option C. A food storage bag. Option D. A plain office recycling bin. The correct answer is option A. A biohazard marked container according to facility policy. Blood-contaminated waste requires proper biohazard labeling and disposal to protect staff and waste handlers. Office recycling, food bags, and unlabeled boxes do not communicate exposure risk or meet safe handling expectations. Question 12. During a skills check, the scenario states that smoke is seen near an electrical outlet in the clinic for a patient with diabetes. Which action aligns with the race fire response sequence? Option A. Ignore the smoke until flames appear. Option B. Open all doors to ventilate smoke. Option C. Rescue patients in immediate danger and activate the alarm according to policy. Option D. Collect insurance cards before leaving. The correct answer is option C. Rescue patients in immediate danger and activate the alarm according to policy. RACE emphasizes rescuing those in danger, activating alarm, containing fire, and extinguishing or evacuating as appropriate. Administrative tasks, opening doors, or ignoring smoke can worsen danger and delay response. Question 13. After confirming the patient's identity, a box of supplies must be lifted from the floor. Which technique helps prevent injury? Option A. Bend at the knees and keep the load close to the body. Option B. Hold the box far away from the body. Option C. Lock the knees and lift with the back. Option D. Twist at the waist while lifting. The correct answer is option A. Bend at the knees and keep the load close to the body. Using the legs and keeping the load close reduces strain on the back. Twisting, holding weight away, and lifting with locked knees increase risk of musculoskeletal injury. Question 14. During a clinical skills check, a new patient is involved when a small blood spill occurs on an exam room floor while following standard precautions. Which action should be included? Option A, cover it with paper and leave it for housekeeping tomorrow. Option B, wear appropriate PPE and disinfect according to bloodborne pathogen policy. Option C, ask a visitor to wipe it up. Option D, clean it with a dry tissue only. The correct answer is option B, wear appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 15. After confirming the patient's identity, an EKG tracing has wandering baseline and one electrode is peeling away for a patient who appears anxious. Which action is best? Option A, reattach or replace the loose electrode after preparing the skin. Option B, tell the patient the heart rhythm is definitely abnormal. Option C, leave the electrode loose to avoid discomfort. Option D, write normal on the tracing without review. The correct answer is option A, reattach or replace the loose electrode after preparing the skin. A loose electrode can cause baseline wander or signal loss, so correcting the connection is appropriate. Diagnosing the rhythm, leaving the problem, or labeling the tracing without review is outside proper procedure. Question 16. After confirming the patient's identity, multiple tubes including blood cultures are ordered during venipuncture. Which specimen is collected first in the standard order of draw? Option A, lavender EDTA tube. Option B, blood cultures. Option C, gray fluoride tube. Option D, red serum tube after all additives. The correct answer is option B, blood cultures. Blood cultures are collected first to reduce contamination risk before additive tubes are drawn. Drawing EDTA, fluoride, or later serum tubes first can interfere with the proper sequence and specimen integrity. Question 17. For a pediatric patient in an outpatient setting, a complete blood count is ordered for a patient while preparing for provider review. Which tube is most appropriate? Option A, plain urine cup. Option B, light blue citrate tube. Option C, gray fluoride tube. Option D, lavender EDTA tube. The correct answer is option D, lavender EDTA tube. Lavender tubes contain EDTA, which preserves blood cells for hematology testing such as a complete blood count. Citrate, fluoride, and urine containers do not provide the correct specimen type for a CBC. Question 18. While rooming a patient, a chemistry test requires serum rather than whole blood for a patient in the exam room. Which specimen type is needed? Option A, a throat swab placed in urine preservative. Option B, blood mixed continuously with EDTA. Option C, blood allowed to clot before serum is separated. Option D, a finger stick smear without clotting. The correct answer is option C, blood allowed to clot before serum is separated. Serum is the liquid portion obtained after blood clots and is separated from the clot. EDTA whole blood, incorrect swab handling, and an unprocessed finger stick smear do not provide serum. Question 19. For an adult patient in an outpatient setting, venipuncture is being performed in the antecubital area. Which insertion technique is generally appropriate? Option A, insert the needle bevel up at about a 15 to 30 degree angle. Option B, insert through the vein and redirect repeatedly. Option C, insert parallel under the skin for several inches. Option D, insert bevel down at a 90 degree angle. The correct answer is option A, insert the needle bevel up at about a 15 to 30 degree angle. A bevel up 15 to 30 degree approach helps enter the vein safely during routine venipuncture. Steep angles, long shallow tunneling, and repeated redirection increase discomfort and complication risk. Question 20. During a clinical skills check, a competent adult refuses a recommended injection after confirming office policy. Which action is appropriate? Option A, notify the provider and document the refusal according to policy. Option B, hide the syringe in another medication. Option C, force the injection because it was ordered. Option D, delete the order without telling anyone. The correct answer is option A, notify the provider and document the refusal according to policy. Competent patients generally have the right to refuse care, and the refusal should be communicated and documented. Force, deception, or unauthorized deletion violates autonomy and safe practice. Question 21. Before the provider enters the room, a patient in the exam room is involved when a patient scheduled for a fasting lipid panel says they ate breakfast for a patient in the exam room. Which action is best? Option A, tell the patient to skip water for the rest of the day. Option B, collect and label it fasting anyway. Option C, cancel all future appointments. Option D, follow facility policy and notify the provider or lab before collecting if fasting is required. The correct answer is option D. Follow facility policy and notify the provider or lab before collecting if fasting is required. A fasting requirement affects interpretation, so the situation should be handled according to policy before collection. Labeling a non-fasting specimen as fasting, giving unsafe instructions, or canceling unrelated care is inappropriate. Question 22. In a medical assistant certification review scenario, a urine culture is ordered for a patient with possible infection. Which instruction is appropriate? Option A, touch the inside of the lid to keep it nearby. Option B, fill the container with water before collecting urine. Option C, clean the area and collect a midstream specimen in the sterile container. Option D, collect from the toilet bowl after voiding. The correct answer is option C, clean the area and collect a midstream specimen in the sterile container. A clean catch midstream technique reduces contamination for culture results. Touching sterile surfaces, collecting from the toilet, or adding water can contaminate or dilute the specimen. Question 23. At a new patient intake, a point-of-care test control result is outside the acceptable range while preventing documentation errors. Which action should occur before testing patients? Option A. Do not report patient results until the control problem is resolved. Option B, throw away the control log. Option C, change patient results to match expectations. Option D, continue testing because controls are optional. The correct answer is option A. Do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 24. While following clinic policy, the medical assistant notes that a urine specimen cannot be tested promptly for a patient with diabetes. Which action preserves specimen quality according to policy? Option A, place it near a sunny window to keep warm. Option B, refrigerate or preserve it if testing is delayed beyond the allowed time. Option C, leave it uncapped at room temperature all day. Option D, mix it with another patient's specimen. The correct answer is option B, refrigerate or preserve it if testing is delayed beyond the allowed time. Delayed urine testing can allow bacterial growth or chemical changes, so refrigeration or preservatives may be required. Leaving it uncapped, warming it, or mixing specimens compromises results and patient identification. Question 25. In a medical assistant certification review scenario, specimens need to be spun in a centrifuge. Which safety step is required? Option A, place tubes at random angles. Option B, open the lid while the rotor is moving. Option C, spin a single tube alone for faster results. Option D, balance tubes of similar size and volume across from each other. The correct answer is option D, balance tubes of similar size and volume across from each other. Balancing the centrifuge prevents vibration, tube breakage, and equipment damage. Spinning unbalanced loads, opening the lid during motion, or random placement creates safety and specimen risks. Question 26. After confirming the patient's identity, specimens need to be spun in a centrifuge during a realistic certification question. Which safety step is required? Option A, open the lid while the rotor is moving. Option B, balance tubes of similar size and volume across from each other. Option C, spin a single tube alone for faster results. Option D, place tubes at random angles. The correct answer is option B, balance tubes of similar size and volume across from each other. Balancing the centrifuge prevents vibration, tube breakage, and equipment damage. Spinning unbalanced loads, opening the lid during motion, or random placement creates safety and specimen risks. Question 27. While following clinic policy, the medical assistant notes that blood cultures are being collected for a patient with limited mobility. Which step is especially important? Option A, use proper skin antisepsis and avoid contaminating the cleaned site. Option B, draw through visibly dirty skin. Option C, skip antisepsis because culture bottles contain additives. Option D, palpate the site again with an unclean glove after cleaning. The correct answer is option A. Use proper skin antisepsis and avoid contaminating the cleaned site. Blood cultures are highly sensitive to contamination, so skin antisepsis and maintaining the cleaned field are critical. Touching the site again, skipping antisepsis, or drawing through dirty skin can cause false positive results. Question 28. A medical assistant reviews a case where a labeled blood specimen is being sent to the laboratory. Which packaging is appropriate? Option A, tape it to the outside of the requisition. Option B, carry it open in a coat pocket. Option C, put it loose in the regular mail bin. Option D, place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. The correct answer is option D. Place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Biohazard transport bags help contain leaks and keep paperwork protected from contamination. Pockets, taped tubes, and loose mail bin transport create exposure and specimen handling risks. Question 29. A medical assistant reviews a case where a 12-lead EKG is being set up during a quality control check. Where is lead V1 placed? Option A, on the right wrist beside the limb lead. Option B, 5th intercostal space at the left anterior axillary line. Option C, 2nd intercostal space at the left midclavicular line. Option D, a 4th intercostal space at the right sternal border. The correct answer is option D, 4th intercostal space at the right sternal border. V1 is placed at the 4th intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 30. For a patient in the exam room in an outpatient setting, a staff member needs to discuss lab results with a patient for a patient in the exam room. Which location best protects confidentiality? Option A, a public elevator. Option B, the clinic's social media page. Option C, a private area away from other patients. Option D, the crowded waiting room. The correct answer is option C, a private area away from other patients. Private conversations protect the patient's health information from unnecessary disclosure. Waiting rooms, elevators, and social media are inappropriate places to discuss confidential results. Question 31. Before documenting in the chart, an EKG tracing has wandering baseline and one electrode is peeling away. Which action is best? Option A, reattach or replace the loose electrode after preparing the skin. Option B, tell the patient the heart rhythm is definitely abnormal. Option C, leave the electrode loose to avoid discomfort. Option D, write normal on the tracing without review. The correct answer is option A, reattach or replace the loose electrode after preparing the skin. A loose electrode can cause baseline wander or signal loss, so correcting the connection is appropriate. Diagnosing the rhythm, leaving the problem, or labeling the tracing without review is outside proper procedure. Question 32. In a medical assistant certification review scenario, a patient is going home with a Holter monitor during clinical workflow. Which instruction is important? Option A, remove the electrodes whenever symptoms occur. Option B, take a shower with the monitor unless told otherwise. Option C, avoid writing down chest discomfort. Option D, keep a diary of symptoms and activities during monitoring. The correct answer is option D, keep a diary of symptoms and activities during monitoring. A symptom and activity diary helps correlate patient experiences with recorded heart rhythm data. Removing electrodes, getting the device wet against instructions, or failing to note symptoms reduces the usefulness of the test. Question 33. At the front desk handoff, a regular EKG rhythm has 4 large boxes between our waves for a patient who appears anxious. Which approximate heart rate is calculated using the 300 method? Option A, 120 beats per minute. Option B, 40 beats per minute. Option C, 75 beats per minute. Option D, 300 beats per minute. The correct answer is option C, 75 beats per minute. For a regular rhythm, dividing 300 by the number of large boxes gives an estimate, so 300 divided by 4 equals 75. The other values do not match the 300 method for 4 large boxes. Question 34. While following clinic policy, the medical assistant notes that a 12-lead EKG requires limb electrodes. Which label belongs on the right arm area? Option A, RA. Option B, LA. Option C, LL. Option D, V4. The correct answer is option A, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 35. A medical assistant reviews a case where a provider asks the medical assistant to prepare for suture removal after reviewing the order. Which supply is commonly needed? Option A, sterile suture removal scissors or a sterile blade with forceps according to policy. Option B, a blood pressure cuff only. Option C, a urine culture cup only. Option D, a meal tray. The correct answer is option A, sterile suture removal scissors or a sterile blade with forceps according to policy. Suture removal uses appropriate sterile instruments and infection control technique. A cuff, urine cup, or meal tray does not remove sutures safely. Question 36. During a geriatric visit, an older adult is involved when a patient preparing for a cardiac stress test asks what symptoms to report for an older adult. Which symptom should be reported immediately? Option A, chest pain, severe shortness of breath, dizziness, or feeling faint. Option B, preference for a different magazine. Option C, mild boredom with waiting. Option D, hunger after skipping breakfast. The correct answer is option A, chest pain, severe shortness of breath, dizziness, or feeling faint. Chest pain, severe dyspnea, dizziness, and faintness can signal serious exercise intolerance or cardiac stress. Boredom, reading preferences, and routine hunger may be addressed but are not the urgent stress test warning symptoms. Question 37. For a patient with a routine complaint in an outpatient setting, a patient is scheduled for an antibiotic injection. Which step is essential before administration? Option A, ask about allergies and check the record for documented reactions. Option B, give half the dose without checking. Option C, assume no allergy if the patient is young. Option D, ask only whether the patient likes injections. The correct answer is option A, ask about allergies and check the record for documented reactions. Medication allergies must be assessed before administration because reactions can be serious. Age, arbitrary dose changes, or preferences about injections do not replace allergy verification. Question 38. After confirming the patient's identity, a medication is ordered by the subcutaneous route while preparing for provider review. Where is the medication intended to be placed? Option A, into the outer layer of bone. Option B, directly into a vein. Option C, into the spinal canal. Option D, into the fatty tissue beneath the skin. The correct answer is option D, into the fatty tissue beneath the skin. Subcutaneous injections deliver medication into the tissue layer beneath the skin and above muscle. Intravenous, bone, and spinal routes are different procedures with different risks and training requirements. Question 39. A provider asks for assistance because a patient brings several prescription bottles to a visit for a teen patient. What is the purpose of medication reconciliation? Option A, record only medications purchased at the clinic. Option B, throw away medications that look old without asking. Option C, compare all current medications to identify omissions, duplications, or interactions. Option D, replace the provider's medication review. The correct answer is option C, compare all current medications to identify omissions, duplications, or interactions. Medication reconciliation creates an accurate medication list and helps identify potential safety concerns. Discarding medications, replacing the provider's role, or omitting outside prescriptions can create incomplete information. Question 40. During a walk-in visit, a returning patient is involved when a patient asks why pulse may be checked before taking a beta blocker during the visit. Which explanation is accurate? Option A, beta blockers can lower heart rate and blood pressure. Option B, they always raise blood glucose immediately. Option C, they make pulse checks unnecessary. Option D, they are used only as antibiotics. The correct answer is option A, beta blockers can lower heart rate and blood pressure. Beta blockers commonly reduce heart rate and blood pressure, making pulse assessment clinically relevant. They are not antibiotics, do not always raise glucose immediately, and do not eliminate the need for monitoring. Question 41. While following clinic policy, the medical assistant notes that a patient taking furosemide asks why urination has increased for a patient scheduled for a procedure. Which explanation is most accurate? Option A, diuretics stop kidney filtration completely. Option B, diuretics are vaccines against infection. Option C, diuretics are used only for pain relief. Option D, diuretics help the body remove excess fluid through urine. The correct answer is option D. Diuretics help the body remove excess fluid through urine. Furosemide is a diuretic that increases fluid and electrolyte excretion through the kidneys. It does not stop filtration, function as a vaccine, or serve only as an analgesic. Question 42. In a medical assistant certification review scenario, a patient develops hives, wheezing, and throat tightness after an injection. Which emergency medication may be indicated by protocol? Option A, epinephrine. Option B, routine multivitamin. Option C, oral iron only. Option D, topical sunscreen. The correct answer is option A, epinephrine. Epinephrine is the first-line emergency medication commonly used for anaphylaxis because it supports airway and circulation. Iron, sunscreen, and multivitamins do not treat acute allergic airway compromise. Question 43. While following clinic policy, the medical assistant notes that a handwritten order uses the abbreviation U for units before documentation is completed. Which action is safest? Option A, change it to milligrams without asking. Option B, assume U means unlimited refills. Option C, clarify the order because you can be misread. Option D, ignore the abbreviation and give any dose. The correct answer is option C, clarify the order because you can be misread. The abbreviation U can be mistaken for a zero or other marking, so clarification prevents dosing errors. Guessing, changing units, or giving an arbitrary dose is unsafe. Question 44. During a skills check, the scenario states that a patient is placed on contact precautions for a draining wound for a patient who appears anxious. Which PPE is typically expected when entering for direct care? Option A, only a surgical mask for every interaction. Option B, no PPE because drainage is covered. Option C, gloves and gown as indicated by the isolation signage. Option D, sterile gloves instead of all other PPE. The correct answer is option C, gloves and gown as indicated by the isolation signage. Contact precautions commonly require gloves and gown for direct contact with the patient or environment. A mask alone, no PPE, or sterile gloves without other indicated protection does not match the purpose of contact precautions. Question 45. A medical assistant reviews a case where an order is for 500 milligrams and the available tablets are 250 milligrams each. How many tablets are needed? Option A, 4 tablets. Option B, 10 tablets. Option C, 0.5 tablet. Option D, 2 tablets. The correct answer is option D, 2 tablets. Dividing the ordered dose of 500 milligrams by 250 milligrams per tablet gives 2 tablets. The other amounts would provide too little or too much medication. Question 46. In a medical assistant certification review scenario, a vaccine is administered in the clinic while working under provider supervision. Which detail should be documented? Option A, a guess at the manufacturer if the label is missing. Option B, the weather outside the clinic. Option C, vaccine name, lot number, expiration date, site, route, and patient response is required. Option D, only the patient's favorite pharmacy. The correct answer is option C, vaccine name, lot number, expiration date, site, route, and patient response is required. Vaccine documentation supports traceability, safety monitoring, and legal requirements. Pharmacy preference, weather, and guest manufacturer details do not replace required vaccine records. Question 47. For a patient with diabetes in an outpatient setting, a provider describes a patient's heart rate as bradycardic for a patient with diabetes. What does this mean? Option A, high blood sugar. Option B, absent breathing. Option C, faster than normal heart rate. Option D, slower than normal heart rate. The correct answer is option D, slower than normal heart rate. Bradycardia means a slower than normal heart rate based on clinical context. Tachycardia, apnea, and hyperglycemia describe different findings. Question 48. During a geriatric visit, a patient's blood glucose is described as hyperglycemic. What does the prefix hyper indicate? Option A, without pain. Option B, around the heart. Option C, below normal. Option D, high or excessive. The correct answer is option D, high or excessive. Hyper means high or excessive, so hyperglycemia refers to elevated blood glucose. Below normal, around the heart, and without pain are represented by different word parts. Question 49. During a skills check, the scenario states that a radial pulse feels uneven during a rooming assessment while prioritizing patient safety. Which measurement is most appropriate to obtain next? Option A, skip the pulse and document unable to assess. Option B, use only the patient's reported usual heart rate. Option C, count the apical pulse for a full minute. Option D, estimate the pulse for 15 seconds and multiply by 4. The correct answer is option C, count the apical pulse for a full minute. An irregular rhythm should be assessed for a full minute at the apical site for a more accurate rate. Short estimates, omitted measurements, or patient-reported values do not provide dependable clinical information. Question 50. After confirming the patient's identity, a patient uses a rescue inhaler during episodes of wheezing for an adult patient. Which process is commonly involved in asthma? Option A, bronchoconstriction and airway inflammation. Option B, excess bone growth in the femur. Option C, loss of tooth enamel only. Option D, failure of the eardrum to vibrate. The correct answer is option A, bronchoconstriction and airway inflammation. Asthma commonly involves narrowed inflamed airways that can cause wheezing and shortness of breath. Bone growth, eardrum movement, and tooth enamel loss do not explain asthma symptoms. Question 51. For an adult patient in an outpatient setting, a patient asks which organ produces insulin. Which organ should be identified? Option A, spleen. Option B, thyroid cartilage. Option C, pancreas. Option D, gallbladder. The correct answer is option C, pancreas. The pancreas contains cells that produce insulin for blood glucose regulation. The spleen, gallbladder, and thyroid cartilage do not produce insulin. Question 52. In a medical assistant certification review scenario, a medical term ends in itis while prioritizing patient safety. What does the suffix usually mean? Option A, inflammation. Option B, blood condition. Option C, visual examination. Option D, surgical removal. The correct answer is option A, inflammation. Itis means inflammation, as in dermatitis or tonsillitis. Surgical removal, visual examination, and blood condition are usually represented by ectomy, scopy, and EMEA. Question 53. Before the provider enters the room, a procedure name ends in ectomy for a returning patient. What does the suffix mean? Option A, surgical removal. Option B, enlargement. Option C, inflammation. Option D, paralysis. The correct answer is option A, surgical removal. Ectomy means surgical removal, such as appendectomy. Inflammation, paralysis, and enlargement use different suffixes. Question 54. During an annual wellness visit, a returning patient is involved when a patient is using a nebulizer treatment in the office. Which instruction is appropriate? Option A, turn the machine off whenever mist appears. Option B, drink the medication from the cup. Option C, share the mouthpiece with another patient. Option D, breathe normally through the mouthpiece or mask as directed until treatment is complete. The correct answer is option D, breathe normally through the mouthpiece or mask as directed until treatment is complete. Nebulizers convert medication into mist for inhalation, so breathing through the device as directed is needed. Drinking medication, stopping at the start, or sharing equipment is unsafe and ineffective. Question 55. A medical assistant reviews a case where a rash is described as proximal to the wrist during a high-yield exam review. What does proximal mean? Option A, toward the skin surface. Option B, farther from the trunk. Option C, on the back side only. Option D, closer to the trunk or point of attachment. The correct answer is option D, closer to the trunk or point of attachment. Proximal means closer to the trunk or the point where a limb attaches. Distal, posterior, and superficial refer to different anatomical directions. Question 56. In a medical assistant certification review scenario, A patient is lying flat on the back for an exam for a patient waiting for the provider. Which position is this? Option A, prone. Option B, lithotomy. Option C, supine. Option D, Sims. The correct answer is option C, supine. Supine means lying face up on the back. Prone is face down, lithotomy uses stirrups, and Sims is a side-lying position. Question 57. For a teen patient in an outpatient setting, a patient reports burning during urination and urinary frequency. Which condition may be suspected? Option A, myopia. Option B, sprained ankle only. Option C, urinary tract infection. Option D, otitis externa. The correct answer is option C, urinary tract infection. Burning with urination and frequency are common symptoms associated with urinary tract infection. Ear canal infection, nearsightedness, and ankle injury do not best explain urinary symptoms. Question 58. During an annual wellness visit, a patient with limited mobility is involved when a patient has low hemoglobin and complains of fatigue after the patient asks a follow-up question. Which condition is being described? Option A, hypertension. Option B, appendicitis. Option C, dermatophyte infection. Option D, anemia. The correct answer is option D, anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 59. After confirming the patient's identity, a medication list includes atorvastatin for a patient with diabetes. Which medication class does this represent? Option A, bronchodilator used for acute wheezing only. Option B, anticoagulant used to dissolve clots instantly. Option C, diuretic used to increase urine output. Option D, statin used to lower cholesterol. The correct answer is option D, statin used to lower cholesterol. Atorvastatin is a statin used to help manage cholesterol levels. Diuretics, anticoagulants, and bronchodilators have different purposes and mechanisms. Question 60. While following clinic policy, the medical assistant notes that an insurance plan must approve a medication before it is dispensed. What process is being requested? Option A, alphabetic indexing. Option B, prior authorization. Option C, coinsurance posting. Option D, waive scheduling. The correct answer is option B, prior authorization. Prior authorization is payer approval required before certain medications or services are covered. Coinsurance, scheduling style, and filing order are separate administrative concepts. Question 61. For an adult patient in an outpatient setting, a patient receives a statement from insurance showing allowed charges and payments after confirming office policy. What is this document called? Option A, incident report. Option B, prescription label. Option C, explanation of benefits. Option D, advance directive. The correct answer is option C, explanation of benefits. An explanation of benefits summarizes how an insurance claim was processed and what may be owed. Advance directives, incident reports, and prescription labels serve different purposes. Question 62. A provider asks for assistance because an insurance plan states the patient must pay a set amount before coverage begins for a patient scheduled for a procedure. Which term applies? Option A, consent form. Option B, contraindication. Option C, deductible. Option D, copayment. The correct answer is option C, deductible. A deductible is the amount the patient pays before the plan begins paying for covered services. A copayment, consent form, and contraindication are different healthcare terms. Question 63. A medical assistant reviews a case where a claim needs a code for the patient's diagnosis. Which code set is used? Option A, CPT only. Option B, HCPCS Level 2 only. Option C, ICD-10-CM. Option D, NDC only. The correct answer is option C, ICD-10-CM. ICD-10-CM codes describe diagnoses and reasons for encounters. CPT, HCPCS Level 2, and NDC identify procedures, supplies, or drug products rather than diagnoses. Question 64. When preparing safe patient care, an EKG tracing has wandering baseline and one electrode is peeling away while preparing for provider review. Which action is best? Option A, write normal on the tracing without review. Option B, leave the electrode loose to avoid discomfort. Option C, tell the patient the heart rhythm is definitely abnormal. Option D, reattach or replace the loose electrode after preparing the skin. The correct answer is option D, reattach or replace the loose electrode after preparing the skin. A loose electrode can cause baseline wander or signal loss, so correcting the connection is appropriate. Diagnosing the rhythm, leaving the problem, or labeling the tracing without review is outside proper procedure. Question 65. During a skills check, the scenario states that a provider marks diagnoses and services after the visit for billing for a patient who appears anxious. Which document is often used? Option A, superbill or encounter form. Option B, electrode tab. Option C, autoclave pouch. Option D, suture package. The correct answer is option A, superbill or encounter form. A superbill or encounter form captures visit services and diagnoses for billing workflow. Sterilization pouches, suture packages, and electrode tabs are clinical supplies rather than billing documents. Question 66. A medical assistant reviews a case where an outside attorney requests a copy of a patient's medical record. Which action is generally required before release? Option A, post the record in the portal without checking identity. Option B, send the record because the attorney sounds official. Option C, give only verbal gossip about the visit. Option D, obtain a valid authorization or follow a permitted legal process. The correct answer is option D, obtain a valid authorization or follow a permitted legal process. Medical records generally require patient authorization or a valid legal basis before disclosure. Official-sounding requests, unchecked portal release, and informal gossip violate confidentiality. Question 67. For a patient waiting for the provider in an outpatient setting, paper charts are filed alphabetically during a quality control check. Which name is usually used first? Option A, street number only. Option B, favorite color. Option C, appointment room number. Option D, patient's last name. The correct answer is option D, patient's last name. Alphabetic filing generally starts with the patient's last name to maintain consistent record organization. Color preferences, street numbers, and room numbers do not provide reliable alphabetic indexing. Question 68. When preparing safe patient care, several patients are scheduled at the beginning of the hour and seen in order of arrival or need for an adult patient. Which system is this? Option A, double entry bookkeeping. Option B, wave scheduling. Option C, pulse deficit scheduling. Option D, sterilization cycle. The correct answer is option B, wave scheduling. Wave scheduling brings multiple patients in during a time block to manage provider flow. Bookkeeping, sterilization, and pulse comparison are unrelated concepts. Question 69. For a patient with a routine complaint in an outpatient setting, an insurance plan states the patient must pay a set amount before coverage begins. Which term applies? Option A, consent form. Option B, copayment. Option C, deductible. Option D, contraindication. The correct answer is option C, deductible. A deductible is the amount the patient pays before the plan begins paying for covered services. A copayment, consent form, and contraindication are different healthcare terms. Question 70. During a morning clinic session, a patient requests correction of information in the medical record after confirming office policy. Which action is appropriate? Option A, follow the facility process for an amendment or addendum. Option B, erase the original entry without documentation. Option C, tell the patient records can never be reviewed. Option D, change another patient's chart instead. The correct answer is option A, follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 71. For a patient with diabetes in an outpatient setting, a billing call is made about an overdue balance for a patient with diabetes. Which practice protects privacy? Option A, leave detailed diagnosis information on a shared voicemail. Option B, discuss the balance with anyone who answers. Option C, verify the patient's identity before discussing account details. Option D, announce the debt in the waiting room. The correct answer is option C, verify the patient's identity before discussing account details. Identity verification helps protect financial and health information during billing conversations. Sharing details with unknown persons, detailed shared voicemail, or public announcements violates privacy. Question 72. For an older adult in an outpatient setting, a patient has questions about risks before a minor procedure. Who should answer clinical risk questions for informed consent? Option A. The provider performing or ordering the procedure. Option B. The medical assistant by guessing. Option C. The receptionist only. Option D. A random patient in the lobby. The correct answer is option A. The provider performing or ordering the procedure. The provider is responsible for explaining risks, benefits, and alternatives so the patient can give informed consent. Reception staff, other patients, or guest explanations do not meet informed consent standards. Question 73. During a skills check, the scenario states that a procedure is performed after the patient clearly refuses touching while preventing documentation errors. Which legal concern may apply? Option A. Defamation only. Option B. Capitation. Option C. Battery. Option D. Abandonment only. The correct answer is option C. Battery. Battery involves unauthorized physical contact and can occur when touching continues after refusal. Defamation, abandonment, and capitation refer to different legal or payment concepts. Question 74. A medical assistant reviews a case where a patient has low hemoglobin and complains of fatigue for a patient scheduled for a procedure. Which condition is being described? Option A. Appendicitis. Option B. Hypertension. Option C. Anemia. Option D. Dermatophyte infection. The correct answer is option C. Anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 75. For a pediatric patient in an outpatient setting, a patient has written instructions about future medical care if unable to speak. Which document is this? Option A. Daily deposit slip. Option B. Superbill. Option C. Advance directive. Option D. Autoclave indicator. The correct answer is option C. Advance directive. An advance directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 76. A provider asks for assistance because a patient uses a traditional health practice unfamiliar to the medical assistant during the visit. Which response is best? Option A. Ignore it even if it may affect care. Option B. Ridicule the practice in the chart. Option C. Ask respectful, non-judgmental questions and share relevant information with the provider. Option D. Tell the patient to stop without provider input. The correct answer is option C. Ask respectful, non-judgmental questions and share relevant information with the provider. Cultural competence involves respectful curiosity and accurate communication that supports safe care. Ridicule, unsupported instructions, or ignoring relevant practices can damage trust and miss safety issues. Question 77. In a medical assistant certification review scenario, a patient is anxious about a procedure for a teen patient. Which behavior shows active listening? Option A. Maintain appropriate eye contact and summarize the patient's concern. Option B. Tell the patient anxiety is silly. Option C. Interrupt to finish the patient's sentences. Option D. Look away and type unrelated notes. The correct answer is option A. Maintain appropriate eye contact and summarize the patient's concern. Active listening uses attention, reflection, and clarification to show the patient was heard. Interrupting, disengaging, or minimizing feelings can increase anxiety and reduce trust. Question 78. After confirming the patient's identity, a patient says they are scared about a biopsy result. Which response is therapeutic? Option A. You should not ask questions. Option B. Everyone gets scared, so stop worrying. Option C. I know for sure nothing is wrong. Option D. That sounds frightening. I can let the provider know you have concerns. The correct answer is option D. That sounds frightening. I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 79. A medical assistant reviews a case where a pelvic exam is being prepared while following standard precautions. Which action supports patient comfort and privacy? Option A, leave the patient uncovered until the provider arrives. Option B, discuss private details loudly outside the room. Option C, provide appropriate draping and explain each step within the assistant's role. Option D, invite unrelated staff to observe. The correct answer is option C, provide appropriate draping and explain each step within the assistant's role. Draping and respectful explanations protect dignity and reduce anxiety. Unnecessary exposure, unrelated observers, and loud discussion violate privacy. Question 80. At the front desk handoff, a returning patient is involved when a child has injuries that raise reasonable suspicion of abuse for a returning patient. Which action is appropriate? Option A, ignore it because reporting is uncomfortable. Option B, ask the suspected abuser for permission to report. Option C, post pictures online to get opinions. Option D, follow mandatory reporting and office policy immediately. The correct answer is option D, follow mandatory reporting and office policy immediately. Healthcare workers may have mandatory reporting duties when abuse is suspected, depending on law and policy. Ignoring signs, seeking permission from a suspected abuser, or posting information online is unsafe and inappropriate. Question 81. At a community health clinic, a teen patient is involved when an office policy emphasizes avoiding preventable patient harm. Which ethical principle is involved? Option A, non-maleficence. Option B, capitation. Option C, downcoding. Option D, respondeat copying. The correct answer is option A, non-maleficence. Non-maleficence means avoiding harm and is central to safe healthcare practice. Capitation and downcoding are payment or coding terms, while the third option is not a valid ethical principle. Question 82. For a patient with hypertension in an outpatient setting, a clinic applies appointment policies fairly to all patients during clinical workflow. Which ethical principle is reflected? Option A, polyuria. Option B, tachycardia. Option C, hemolysis. Option D, justice. The correct answer is option D, justice. Justice involves fairness and equitable treatment. Tachycardia, hemolysis, and polyuria are clinical terms rather than ethical principles. Question 83. A provider asks for assistance because a patient becomes angry about a long wait for a teen patient. Which response is best? Option A, use a calm voice, acknowledge the frustration, and offer to check the status. Option B, threaten to cancel care immediately without policy. Option C, argue loudly in front of other patients. Option D, mock the patient's concern. The correct answer is option A. Use a calm voice, acknowledge the frustration, and offer to check the status. De-escalation uses calm communication and problem-solving to reduce tension. Arguing, mocking, or threatening without policy can escalate the situation and harm the patient relationship. Question 84. In a busy family practice clinic, a patient begins having a seizure in the exam room while preventing documentation errors. Which action is appropriate? Option A, offer food during the seizure. Option B, put fingers in the patient's mouth. Option C, protect the patient from injury and do not restrain movements. Option D, hold the patient down forcefully. The correct answer is option C, protect the patient from injury and do not restrain movements. Seizure first aid focuses on safety, protecting the head, and allowing the seizure to pass without restraint. Placing objects in the mouth, forceful restraint, or giving food during a seizure can injure the patient. Question 85. A medical assistant reviews a case where a patient develops wheezing and facial swelling after a medication for a patient with limited mobility. Which response is appropriate? Option A, activate emergency protocol and prepare to assist with ordered epinephrine. Option B, schedule a routine follow-up in 6 months. Option C, tell the patient to ignore throat symptoms. Option D, offer a glass of water only. The correct answer is option A. Activate emergency protocol and prepare to assist with ordered epinephrine. Wheezing and facial swelling after medication can indicate anaphylaxis, requiring rapid emergency response. Routine scheduling, ignoring airway symptoms, or offering water alone delays potentially life-saving care. Question 86. At a provider-requested assessment, a patient has a minor thermal burn from touching hot equipment. Which first aid action is appropriate? Option A, rub butter into the burn. Option B, break blisters to release fluid. Option C, cool the area with cool running water according to protocol. Option D, apply ice directly for a long time. The correct answer is option C, cool the area with cool running water according to protocol. Cooling a minor burn with cool running water can limit tissue damage and reduce pain. Direct prolonged ice, butter, or breaking blisters can damage tissue or increase infection risk. Question 87. When preparing safe patient care, a patient suddenly has facial drooping and arm weakness during a high-yield exam review. Which emergency condition should be suspected? Option A, routine nearsightedness. Option B, stroke. Option C, simple paperwork fatigue. Option D, seasonal allergies only. The correct answer is option B, stroke. Facial drooping and arm weakness are warning signs captured by FAST for possible stroke. Allergies, vision issues, and paperwork fatigue do not match sudden focal neurologic deficits. Question 88. A provider asks for assistance because a sterile tray is prepared for a minor procedure for an adult patient. Which action maintains sterility? Option A, use items from a wet torn package. Option B, keep sterile items above waist level and within view. Option C, turn away from the sterile field for several minutes. Option D, reach over the field with non-sterile sleeves. The correct answer is option B, keep sterile items above waist level and within view. Sterile fields must remain visible and protected from contamination. Turning away, reaching over the field, or using compromised packages can contaminate supplies. Question 89. During a geriatric visit, a conscious adult cannot speak or cough effectively while choking. Which first aid action is commonly used? Option A, offer a large meal. Option B, abdominal thrusts according to training. Option C, insert a blind finger sweep. Option D, tell the patient to lie flat and sleep. The correct answer is option B, abdominal thrusts according to training. Severe airway obstruction in a conscious adult is commonly treated with abdominal thrusts by trained responders. Food, lying down, or blind finger sweeps can worsen obstruction or injury. Question 90. During a follow-up visit, a patient falls in the hallway and says their hip hurts during a realistic certification question. Which action is appropriate? Option A, lift the patient quickly without assessment. Option B, delete the event if no one saw it. Option C, tell the patient to walk it off. Option D, keep the patient still, call for help, and follow incident protocol. The correct answer is option D, keep the patient still, call for help, and follow incident protocol. After a fall with pain, the patient should not be moved unnecessarily until assessed and help arrives. Rapid lifting, dismissing the injury, or hiding the event can worsen harm and violate reporting procedures. Question 91. At a preventive care appointment, a patient is scheduled for a minor office procedure for a patient with diabetes. Which role may the medical assistant perform? Option A, perform the procedure without provider involvement. Option B, sign the consent for the patient. Option C, explain all surgical risks independently. Option D, witness the patient's signature after the provider obtains consent if office policy allows. The correct answer is option D, witness the patient's signature after the provider obtains consent if office policy allows. Medical assistants may witness signatures according to policy, but the provider explains risks and obtains informed consent. Independent risk counseling, unsupervised procedures, or signing for the patient exceeds the role. Question 92. A provider asks for assistance because a provider asks the medical assistant to prepare for suture removal. Which supply is commonly needed? Option A, a meal tray. Option B, sterile suture removal scissors or a sterile blade with forceps according to policy. Option C, a urine culture cup only. Option D, a blood pressure cuff only. The correct answer is option B, sterile suture removal scissors or a sterile blade with forceps according to policy. Suture removal uses appropriate sterile instruments and infection control technique. A cuff, urine cup, or meal tray does not remove sutures safely. Question 93. When preparing safe patient care, a patient is placed on contact precautions for a draining wound while maintaining privacy. Which PPE is typically expected when entering for direct care? Option A, gloves and gown as indicated by the isolation signage. Option B, sterile gloves instead of all other PPE. Option C, only a surgical mask for every interaction. Option D. No PPE because drainage is covered. The correct answer is option A. Gloves and gown as indicated by the isolation signage. Contact precautions commonly require gloves and gown for direct contact with the patient or environment. A mask alone, no PPE, or sterile gloves without other indicated protection does not match the purpose of contact precautions. Question 94. When preparing safe patient care, a patient is using a nebulizer treatment in the office for a patient scheduled for a procedure. Which instruction is appropriate? Option A. Breathe normally through the mouthpiece or mask as directed until treatment is complete. Option B. Turn the machine off whenever mist appears. Option C. Share the mouthpiece with another patient. Option D. Drink the medication from the cup. The correct answer is option A. Breathe normally through the mouthpiece or mask as directed until treatment is complete. Nebulizers convert medication into mist for inhalation, so breathing through the device as directed is needed. Drinking medication, stopping at the start, or sharing equipment is unsafe and ineffective. Question 95. When preparing safe patient care, a weak patient needs help stepping onto the scale. Which action supports safety? Option A. Ask another patient to help lift. Option B. Use proper body mechanics and assistive devices according to the patient's needs. Option C. Leave the patient unattended on the scale. Option D. Pull the patient quickly by one arm. The correct answer is option B. Use proper body mechanics and assistive devices according to the patient's needs. Safe transfer assistance uses body mechanics, assessment, and appropriate devices to prevent falls. Pulling, leaving the patient unattended, or asking another patient to lift creates safety risk. Question 96. While preparing the exam room, a patient in the exam room is involved when a laboratory specimen lacks patient identifiers while preparing for provider review. Which outcome is likely? Option A. The specimen may be rejected because identity cannot be verified. Option B. It should be mixed with another specimen. Option C. It can be relabeled later from memory. Option D. It should be processed under the nearest room number. The correct answer is option A. The specimen may be rejected because identity cannot be verified. Specimens without proper identifiers may be rejected to protect patient safety. Room number guessing, memory relabelling, or mixing specimens can lead to wrong results assigned to the wrong patient. Question 97. While following clinic policy, the medical assistant notes that a cold pack is applied for a minor injury as ordered for a pediatric patient. Which safety instruction is important? Option A. Use heat at the same time on the same site. Option B. Apply ice directly until the skin turns white. Option C. Place a barrier between the cold pack and skin and monitor the area. Option D. Leave it on for several hours unattended. The correct answer is option C. Place a barrier between the cold pack and skin and monitor the area. A barrier and monitoring reduce the risk of tissue injury from cold exposure. Direct prolonged ice, unattended use, or combining heat and cold inappropriately can harm the skin. Question 98. During a follow-up visit, a patient with a routine complaint is involved when a medical assistant experiences a needle stick while cleaning a room. Which action should be taken first? Option A. Hide the injury if bleeding stops. Option B. Finish all remaining tasks before reporting. Option C. Apply lotion and continue rooming patients. Option D. Wash the area and report the exposure according to policy. The correct answer is option D. Wash the area and report the exposure according to policy. Immediate washing and prompt reporting start the post-exposure process and protect the employee. Hiding the injury, delaying reporting, or simply applying lotion can interfere with timely evaluation and follow-up. Question 99. A medical assistant reviews a case where a radial pulse feels uneven during a rooming assessment before documentation is completed. Which measurement is most appropriate to obtain next? Option A. Estimate the pulse for 15 seconds and multiply by 4. Option B. Skip the pulse and document unable to assess. Option C. Count the apical pulse for a full minute. Option D. Use only the patient's reported usual heart rate. The correct answer is option C. Count the apical pulse for a full minute. An irregular rhythm should be assessed for a full minute at the apical site for a more accurate rate. Short estimates, omitted measurements, or patient-reported values do not provide dependable clinical information. Question 100. In an outpatient medical office, a patient drank hot coffee immediately before an oral temperature is planned for a teen patient. Which action should the medical assistant take? Option A. Ask the patient to sip cold water to balance the reading. Option B. Record the temperature immediately because coffee has no effect. Option C. Use the same probe cover for a repeat reading. Option D. Await before taking the oral temperature or use an approved alternate route. The correct answer is option D. Wait before taking the oral temperature or use an approved alternate route. Hot or cold intake can temporarily alter oral temperature readings, so waiting or using an approved alternate route improves accuracy. Immediate measurement, reused covers, or trying to offset the effect with another drink can create unreliable data and poor infection control.